Thank you so much. That really was a wonderful report by Minister Tarr. It's clear that we're coming out of the pandemic and there's some very dynamic things being done to help move us back in the direction of addressing the challenges that have been lingering around countering trafficking in Liberia. And I can't wait to see how all of these new developments evolve. And it was especially exciting to hear that the trafficking law itself was just updated within the last few weeks. So these are all very heartening developments. So I now want to transition us into the next session, which if you have your schedule know is where we'll have the privilege of hearing from two trafficking research experts from the Wellesley Centers for Women. The Wellesley Centers for Women, which is also known as WCW, is a women and gender-focused academic research and action institute located at Wellesley College, the premier college for women in the United States, located in Wellesley, Massachusetts. WCW harnesses the power of data and gold standard social science research to move the needle on issues affecting women and girls, families and communities, and all their diversity in the United States and around the world. Thanks to researchers like the ones I'm about to introduce, WCW has provided needed data to policymakers, practitioners, activists, and advocates alike for nearly 50 years. Linda M. Williams, PhD, is a senior research scientist and founding director of the Justice and Gender-Based Violence Research Initiative at the Wellesley Centers for Women. For more than 40 years, Linda Williams has directed research on violence against women, sexual exploitation of children, sex offenders, and the consequences of child abuse. The focus of her current work is on justice system response to sexual violence, commercial sexual exploitation of women and children, human trafficking, intimate partner violence, and child maltreatment. Her work strives to ensure that the voices of women and children are heard. Previously, she served as professor of criminal justice and criminology at the University of Massachusetts Lowell from 2005 to 2015. She now serves as professor emerita. Williams has been the principal investigator on 18 U.S. federally funded research projects and has directed research funded by the National Center on Child Abuse and Neglect, the National Institute of Mental Health, the U.S. Department of Justice, the Centers for Disease Control and Prevention, the U.S. Department of Defense, the U.S. Air Force, and many private foundations. In sum, she is one of the leading internationally recognized experts on all forms of gender-based violence. I'd also like to introduce Kate Price, PhD, who is a visiting scholar at the Wellesley Centers for Women at Wellesley College, where she's completing a writing project on the commercial sexual exploitation of children in Appalachia. Prior to her appointment at the Wellesley Centers for Women, Kate Price was also a visiting scholar at the Women's Studies Research Center at Brandeis University. In December 2019, Kate earned her doctorate in sociology from the University of Massachusetts, Boston, and completed her dissertation on state-level legislative decisions to prevent the arrest and prosecution of commercially sexually exploited minors for prostitution in the United States. During her doctoral studies, Price received numerous awards. In 2005, she received a master's degree in gender and cultural studies from Simmons University. A survivor of the commercial sexual exploitation of children, specifically family-controlled child sex trafficking and child sexual abuse imagery, Kate Price frequently collaborates with national and state-level advocates and policymakers to shape and draft policy to combat commercial sexual exploitation of children. She serves on the National Center for Missing and Exploited Children's Child Sex Trafficking Survivor Advisory Board and was a founding member of the End Child Pornography and Trafficking USA, also known as ECPAT USA Advisory Council. A peer reviewer for the Department of Justice, Office of Justice Programs, Price frequently lectures on her research and survivor advocacy at numerous academic conferences, universities, and non-governmental organizations. She has also published numerous articles and reports related to child and adolescent sex trafficking, particularly the legal and legislative aspects. So we're going to hear from Dr. Kate Price first, followed by a presentation by Dr. Linda Williams, and then we'll have time for audience questions and answers. So as you listen, please feel free to add questions to the Q&A box and be prepared to speak at the end of Linda's presentation. Thank you so much, and I'll turn it over to Kate.
Thank you so much, Lily. Thank you so much to the distinguished guests and people sponsoring this. I'm in awe, and I'm very, very privileged and honored to be attending today and participating today. Let me share my screen first for my presentation. Okay, can everyone see that? Wonderful. Okay, so today I will be talking about human trafficking specifically for travel professionals. You all are the eyes and the ears of our travel gateways, and transportation was part of my exploitation. This is not letting me advance. Oh, here we go. Sorry about that. So first, let me share a little bit of my history. I am a survivor, as Dr. Mapayan had said. I am a survivor of family-controlled commercial sexual exploitation of children. I was exploited by an immediate family member from my very first memories until about age 11 or 12, about the time that I had hit puberty. Transportation was part of my exploitation in two ways. One, I was trafficked primarily to truckers. I grew up along an interstate in Northern Appalachia, and truckers were my traffickers' primary clientele. Trafficking does still happen very much at this on the same interstate, and federal and local officials have continued to find a very strong presence of trafficking in this area, which is why I am doing the writing project and I'm working with local officials for that. The other way that transportation was part of my exploitation is when I ran away from home in high school. I actually ran through, I ran away to Smith College, which is a women's college. And so many people run away maybe to exciting places like New York or Las Vegas or something. I ran away to a women's college, and I now work at a women's college. But still, having gone through Port Authority, which is one of the primary recruiting grounds for commercial sexual exploitation of children in the United States, just that I could have been identified in these two places. So therefore, it's really important to me to be talking to local and international officials around travel. Next, I'm going to share a picture of myself of what I looked like when I was being trafficked. And imagery to me is incredibly important. I think we often think about trafficking in terms of chains and ropes and being, trapped in a room, to be covered in bruises, to be look disheveled. This is what I looked like. This was my kindergarten picture. This was literally in the middle of my trafficking. I am the quintessential blonde-haired, blue-eyed child. I was not malnourished. I did not have any visible bruises. I do not look sad. I would have been walking with a family member. And so that poses a very difficult question in terms of how would I have been identified as a trafficking victim? I think it would have been incredibly difficult. When people ask me that question, the only thing I can ever think about is I was often taken out in the middle of the night. And so could have been questioned of like, well, why do you have this child out on a school night, in the middle of the night? To which though, my exploiter, who was a white man, I loved that question when someone said, well, in terms of, white men have the privilege of being believed at everything. My exploiter probably would have said, oh, I'm taking her to the doctor, or, oh, we're traveling to see family, we're having a family emergency. My trafficker was very, very charming. And so I think would have been very much undetected. What I always like to tell people though, is still ask the question, if you are perfect, if you're safe though, make sure that your own safety is there and is paramount. But you can disrupt the process by asking the questions. Like, I don't know, something still feels off. I don't know if I quite believe you that, you're going to the doctor, you're going, because in my experience, exiting trafficking, stopping trafficking, it's not an event, it's a process. It's a process of, granted, in this picture, I was 6 years old. But I did reach out to via CB radio, like a ham radio. I reached out to my trafficker's person who was collaborating. I found him. I knew something was wrong, and I started to ask questions. So you can see I was a social scientist very early. I knew, this person was important to my being trafficked. So just asking questions and disrupting those systems is what is incredibly important. I want to share, we've gone over this quite a bit already, so I just wanted to be clear in terms of what is trafficking. I think oftentimes we do think about transportation and we think about that there has to be, you are being taken from one place to the next. That is true, but you don't have to cross state lines or you don't have to cross borders. I was trafficked in my home. I was in our backyard. I was trafficked at a local rest area, and I was taken 45 minutes away to a more of a central, like an urban hub. But I never crossed state lines. I never left the country. And I barely left my town. In fact, people very much came to me. So it wasn't, those state lines did not have to be crossed in order for this to be trafficking. What is important though is the presence of force, fraud, or coercion. However, it's important for me to say is it's not always even the presence of force, fraud, or coercion by another person. Economic instability is paramount in terms of the systems of trafficking that is often poor children, poor people. Poverty is central. It's economic insecurity is a central component of human trafficking. And so the economy could be what is coercive, not being able to secure employment, not being able to secure housing or food. That's what does the coercing, is a wonderful quote by Rachel Moran. Her book, Paid For, is a wonderful book. I can always put it in the chat. But she talks about life does the coercing. It doesn't necessarily have to be another person. Examples of human trafficking, we've already talked about this. I know we very much, usually focus on sex trafficking. That was my experience, but there's also labor trafficking. A study that I recently did at Massachusetts General Hospital in Boston, we actually found that people who were trafficked for sex, the majority of people were also trafficked for domestic servitude as well. So they were used in both capacities. They were made to do domestic work in the house, and then they were also sex trafficked as well by the same exploiter, which was the first time I had ever seen the majority of victims, were at that intersection of sex trafficking and domestic work. The other piece is talking about throwaway or runaway children, are groomed for sex work by predatory adults, or doing survival sex. Sometimes we talk about like, well, where are the parents? We just need to make sure the parents are more involved. Well, it's children who are actually as in part of Child Protective Services or child welfare who are the most vulnerable. A local organization in Boston called My Life, My Choice, they find that 67 to 75% of the child sex trafficking victims and survivors that they work with have been involved with foster care at one point. So those are the most vulnerable children. Oops, excuse me one second. And then the last, I will also say culturally sanctioned histories of exploitation. Trafficking is very often intergenerational. While I have no empirical proof of this, I am absolutely certain that my exploiter was trafficked by an immediate family member, and that immediate family member who exploited my trafficker was also exploited. This goes back generations upon generations. And it's very much culturally sanctioned. Where I grew up in Appalachia, it was very much this sense of, well, this is just what those families do to one another. That's their role. And so, that it makes me, as a white woman talking about trafficking, child sex trafficking in Liberia, I'm very aware of my positionality there, that I am a white woman and not a person of color. And at the same time, in where I grew up, which is a primarily white area, there's very much of this hierarchy of even within economic impoverishment, there is the lowest of the low. And it was really my job. That was what I was born to do. Basically, it was seen as my job that I was going to be exploited, and that's what we did. And then people were just going to look the other way because that was family business. That's something that we, that people do not get involved in. Like the other piece of what I talk about is in terms of human trafficking, is that human trafficking, it is predicated on dominance and control. Sex trafficking, labor trafficking, we're talking about power and control, particularly of a white patriarchal system. So looking at threats, coercion, but also intimidation, emotional abuse, isolation, denying, blaming, minimizing, sexual abuse. Up to 90% of all human trafficking victims and survivors have significant trauma histories where you have literally a relational template from childhood. This was very much my experience, a relational template from childhood of dominance and control, of being abused, of trauma. And so our bodies are wired to fight, flight, freeze, collapse. And if you're trapped in interpersonal trauma, which I collapsed. That's still what I do to this day, even though I've had, as you might imagine, a tremendous amount of therapy and have done a lot of work to even be able to do this work. My first instinct for when I have a trauma response is to collapse, because that is exactly as our bodies are wired, as our brains are wired. I just shut down in times of trauma dissociated, things like that. So that is what exploiters, that's what traffickers prey upon, that wanting to look for that abuse history so that you do just collapse, that you are used to being isolated, you're used to being betrayed in relational experiences, that you are used to being obedient. Obedience is the absolute number one thing that traffickers look for. And then also just in terms of using physical abuse, using privilege and economic abuse as well. So I highly recommend this this graphic. As you can see, it was adapted from the Domestic Abuse Intervention Project, the Duluth model of power and control, which Minister Tar went to school or in that area. So this is a really important graphic, because I think oftentimes we just really do think about people being locked away, and it really falls into these tropes of the similar tropes of domestic violence of, well, why doesn't the person just leave? Particularly in America, where we are seen as this land of opportunity, this land of Title IX, girls having soccer fields and opportunities and all of these things. How in the world can someone, particularly a blonde hair, blue-eyed white girl, be trapped in trafficking? And it is all of these pieces are the puzzle that keep you, trapped in a psychological state as well. I did just want to leave with a couple indicators and travel resources. As Dr. Mapayan had said, I was actually a founding board member for ECPAT USA, very proud of that. I only left ECPAT USA board just because I was asked to be on another board for the National Centers for Missing and Exploited Children in the United States, and really wanted to open the doors for some new people to be a part of ECPAT, and so then I could move on to the National Centers for Missing and Exploited Children. When I am a part of a board, I really like to give my all to it. And as you might imagine, this work is very difficult for me, but I'm very passionate about it. And so just really having to which is all to say, I'm still a tremendous supporter of ECPAT USA. I know earlier Ms. White had shared some indicators, so I won't go through these. But the tricky, I do like to share this slide though sometimes though, is that because I didn't meet any of these. I didn't meet any of these indicators, even though transportation was part of what was going on. It was part of my exploitation. And at the same time, it is a place to start, because I do also I strongly believe in the work that ECPAT USA has done. And these are kind of a strong indicators of what could be trafficking. And at the same time, I also always remind people to please use your gut. And if you feel that something is off, do it, say it, say something, call 911. And granted that 911 and the police response might be more receptive to a white person than a person of color. And at the same time, acknowledging that privilege is important, that the police work differently for different races and ethnicities and for different classes, but at the same time is still is an important place to start, particularly as we continue with training. I'm stopping my time here, had my timer on. I will just end with this slide, that there are additional resources. I know people had talked about wanting to have additional training. ECPAT USA's website, they are an international organization, but they're the USA arm of the organization has tremendous resources, and they have free online training specifically for travel and hospitality, and they have a separate training for training hotel associates as well. Granted, these are primarily in the United States, but they're free online resources that people may find helpful. There are also sample travel industry anti-trafficking policies and procedures. And as Mr. White had said, in terms of the Tourism Child Protection Code of Conduct, otherwise known as the code that the Atlanta airport has joined, you can get information there from that. And I will also just end by saying thank you to Ms. White and to Mr. Smith in terms of I get very triggered in airports and travel, as you might imagine, but I always enjoy going through the Atlanta airport. And now I see that it's a trauma-informed airport. And so that is, I appreciate all of your work. It is very much noticed by those of us who need it the most. Thank you.
Thank you, Kate, for that very compelling presentation. It was courageous and bold of you to share your personal story, but I know that it really helps inform this audience. And at the same time, it set the stage for everything you had to say in terms of recommendations. So I'm going to ask people to hold their questions for you personally until we can get through Linda's presentation, and we'll take both sets of questions together. So I'm going to turn it over to Linda.
Morning, everyone. Hope you can hear me, and thank you to everyone for organizing this this great meeting of folks, and hopefully it can be of some assistance to you. And thank you to Kate Price for sharing your experiences and helping us to learn more too. And of course, now you're working in this area too, so that's wonderful. I'm going to continue really talking about some of the faces of trafficking in the United States based on our experience with interviewing young people on the streets. And you'll see that I think Kate introduced. Dr. Price introduced also the idea that we can be talking about runaway, homeless, thrown away youth, and they may present a different picture as well. So there's all sorts of issues that we need to address. I'm sure the one important message from today will be this: if you see something, say something, but also you may not see something and you still need to say something when you feel something in your gut. And so that was a good point. A big part of responding to this issue is recognizing trafficking is happening before your own eyes, be it for labor trafficking or sex trafficking or the combination of the two. It's seen as hidden in plain sight, so we do need to identify it, but then we need to also know what to do and have responses that will be useful for stopping it. Not only the laws critical to this, of course, approaches for identifying perpetrators and putting our attention to them and not punishing the survivors or the child victims, because that often is what happens or seems to happen from the point of view, particularly of adolescent youth who are perhaps treated differently too. I hope, oh good, my slides are moving along so you can see them, I hope. So what happens with adolescents when they present to us in the street, they present complex issues. And finding solutions and approaches to help survivors rather than punish them is a challenge, because sometimes we don't really want to deal with adolescents. And so what I did was some research on commercial sex trafficking in the US and interviewed children and young adults who had been on the streets and traded sex for a place to stay or money, or had been actually trafficked, pimped, sold for sex to customers, Johns, I guess I'd rather call them rapists, really. And so these are individuals who had these experiences. And I talked to them. What does this have to do with Liberia? Well, I can't be entirely sure. You'll have to tell me. One big issue is that there are challenging issues when you encounter youth who've been trafficked on the streets, and how to provide the proper supports for them, and work with them. So one really interesting thing, my research focused on 2 cities in the United States, and we asked the young people we interviewed, and we really wanted to hear their stories the way they wanted to tell us. But we said, please, don't share identifying information. Don't talk about cities or locations. And yet we found that's what they talked about very often. They shared information about all the different cities they had been in. There were over 99 cities mentioned, and here we're talking to individuals in 2 cities. So they weren't from those 2 cities most of the time. They talked about 34 other states and even 12 or 14 other countries that they've been to. So these are, in effect, internal migrants. Interesting to use that phrase, because it wasn't until I was attending a child maltreatment conference rather, in an international setting, and the co-panelist happened to be from Myanmar, but he was referring to the same kinds of kids I was talking about as internal migrants. And indeed, that's what they are in the US too. They're individuals who crossing some state lines. They don't have to cross state lines, but who very often have, or even different towns or jurisdictions. And we need to make accommodations for that in our interventions, because you'll run into a child who really wants to go to school, who has a lot of capabilities, or maybe needs medical care. In the United States, we're very not united, as many of you may have observed, but we're not united in terms of jurisdictional issues around who pays for what. So it's hard to get a kid enrolled in a school if that's not her residence or his residence, get the medical care. So we need to pay attention to multi-jurisdictional issues. Of course, that applies also when you're dealing with international trafficking and with kids going from Atlanta from Liberia to another location, to Las Vegas, wherever it is. And how do you get services that are appropriate and make accommodations for this? So that's really an important perspective here. This is kind of a busy slide. I think I just want to convey really here that the lives of these youth, as they described them to me, and as we know from our experience in this field, have been challenging and difficult, but they have survived. They've negotiated life at a very young age. And one of the key themes that came across in the some 60 some odd interviews we did is this notion of survival. Now, it's not survival like we might consider it survival, but for them, it is. They've had to deal with hunger, poverty, violent individuals, protect themselves. And so when we go to the next step of reaching out to help young people in this situation, we can't be viewing ourselves as rescuers. Rather, we need to partner with the youth so that we can hear from them what it is that they need, how they envision assistance, or else they might as well go back to where they were, because they feel forced. they feel abused. And so the partnership with young people, and here I'm particularly talking about, preteens and teenage and adolescents who have the capacity to also talk about this, but that we need to really hear their voices. This is a photo of a medical service van that we encounter in Boston, from an interesting group, and they provide services on the street, for homeless. They park in different locations and they provide some medical services. And to them, these youth are not invisible, but they do honor and try to meet the needs of the youth where they are too. So I had to put this in. I don't know if it's public, and we can I don't own this photo, but Barack Obama in his first administration went and provided volunteer services at a facility that provides services to homeless and runaway youth. And this is really part of the suggestion of the need for us to do something to help those individuals who are in this situation, but not just to, and who are hidden in plain sight. But how do we sort of deal with the fact that they are, so the light goes off in my office. If I put my hands up in the air, it goes back on. Hello. We're saving money at Wellesley Centers for Women every day. Sorry for the interlude. So the point is that you have to see the youth to help them, but you have to listen to them to help them and understand that these individuals need a safe place to stay with nutritious food and services that respect their survivor status and foster resilience rather than controlling them. Young people who've been in these situations have a lot of reasons not to trust adults, not to trust people in power or in charge, because oftentimes those are individuals that have abused them. And so it's very important to recognize this in developing partnerships to work with youth who've been maltreated. Let me see. So really, I just have a final summary slide. Just basically, these are my points. Don't ignore the youth, pay attention to them, and design both research. So if you're going to do more research in this area, you want to hear what's important for youth to know about, have them involved in developing a research study, but also their voices in programming must be heard. We must count and include their voices. And this young man, standing in front of a sign, if you can see it, but says, we believe the only way to keep a young person from returning to the streets is to provide consistent level of service that empowers them, nurtures them, dignifies and supports them. And this is the message we heard over and over again when we interviewed young people on the streets of the United States. So that's my message today, and hopefully we can respond to any questions or suggestions you have. Thank you.
Thank you so much, Linda. That was an incredibly powerful and useful presentation, particularly since the issue of youth and children living on the streets is one in Liberia of concern. And you can be certain that some of the youth who are living on the streets in Liberia are facing some of the same kinds of issues and having some of the same kinds of perspectives that you mentioned. Although obviously it would be incredibly worthwhile to have a study in Liberia similar to the one that you conducted in the United States. Probably some of the findings would be very similar, but others would help highlight some of those cultural nuances that we really care about and help us come up with solutions that are really tailored to the Liberian context. I know that we started this session slightly late, and I want to try to end it still on time. So that gives us about 11 minutes for questions. A few questions have come in, and I'm going to pull those out. One of them came in asking the question of how do we address networking with religious groups regarding education on trafficking? I think this question came from someone who is Pastor Harris, who's interested as a pastor in bringing his church into the conversation and wants to know what are some ways that churches can be helpful in the issues that you've raised. So Linda, you might want to take a stab at that. And then Kate, if you have some commentary on that while I'm lining up the next question.
Well, we've recently been talking about how do you develop more venues for services for individuals who are on the street. And some of the best programs I have run into, and also there was one in London that reminded me of this too. For us, it was Thanksgiving. For them, it was Thursday, but I spent the day at a church that had opened its doors to have time on Thursday mornings for breakfast for those individuals who were trafficked, and there's different laws in England, but who have been exchanging sex for money. And they really wanted to bring them in and link them with services. And that is not unlike a program that existed during the time I was doing this research, existed in Cambridge, Massachusetts. Here you are, a stone's throw from major educational institutions in the United States, and yet there are children who are in these situations. Here, the church opened up its doors. It was not a religious affiliation, but it was a social concerned emphasis, that brought these churches to do this work. So maybe Kate, you have something else.
Yeah, I would echo similar. Churches, I think, provide tremendous resources. And in terms of finding a way for your church to be involved, I would just Google. I mean, churches are a tremendous resource within the anti-trafficking movement throughout the world. The one thing I do caution, though, is that there are some organizations that use, in my experience, organized religion as a way, it's a precursor. I know of one organization that in order to receive services, receive shelter, you literally have to sign a waiver that you accept Jesus as your personal savior. And those conditions, this is again, me personally, I feel like that continues that dominance, that control. You need to do things my way. Granted, I say this as the daughter-in-law of a retired Episcopal minister. Going to church was something that was a very safe place for me growing up. I loved singing the song Jesus Loves Me. I didn't know who this Jesus person was, but like that somebody loved me out there, like I was grateful for it. And I loved going. And church is a very big part of Appalachia. I would love singing, they're called hillbilly hymns, specific hymns that are specific to the Appalachian region that I still love. So I would think of, in terms of religion, I think there's tremendous resource. I think there's tremendous spiritual resource. There's tremendous economic resource. But coming at it from a place of compassion, the Buddhist nun Pema Chodron has a wonderful quote, and I don't know if I'm going to be saying this exactly right, but compassion is not a relationship between the healing and the wounded. It's not that savior thing. It's my darkness, my weakness in me recognizes the darkness and the weakness in you, and let's come together in a shared humanity. And so if your church is coming at this from that perspective, which in my experience, most churches that do work with human trafficking are coming from that, I think there's a tremendous amount you can do. And I'm sure there's probably churches near you that are doing work, just reaching out to your vast network of pastors, being the daughter-in-law of a minister. I know you all are very close and talk all of the time and stuff. So I would just start asking around, and I'm sure you'll be able to find people doing things in your area.
Thank you, Kate. So now I want to turn to a question from a different occupation. Mr. Zina Dekena Goba from the Liberian National Police Force really asks what can he and members of his profession do or learn to be more effective in their work, both at the airport and more generally. So how would you, what suggestions would you make to police officers and police forces wanting to learn how to be more helpful around the issues you raised today?
I think Linda and I could both wax poetic about this for hours because we both really come from a policy perspective. So I will defer to Dr. Williams first, and then I will fill things in. How about we do that?
Thanks. There are so many things that
So many things.
police can do. I was racing through my mind. One is
Uh-huh.
part of this training and seeing something and understanding when they have a person in their car because they think she's a prostitute. And, it's like, figure out how old they are and also understand the dynamics of it. And, there's just so many issues around finding resources for youth. One of the biggest problems we found that police officers feel they have is that they don't know what to do with these kids. So it's like, is she or he a victim or a, perpetrator? And, what they know more about is locking up with the handcuffs and giving them to somebody else. And oftentimes there aren't a lot of services. So we really need to look at helping police find resources and educating them about the problem and then what they can do. One area I found I had some interesting findings about is how did youth end up on the streets in the United States, remember? And police would go to a home where there's domestic violence or where there's been fighting. It could have even involved a teen. And again, it's a matter of having community resources, sort of separating the adults in the way they do regarding domestic violence. But if there's a 14-year-old there saying, can you go stay with your auntie or go stay with your good friend or whatever? Well, this kid ends up then out in the community, couch surfing, a place where he or she is not wanted, and ends up on the street. There were so many youth who had ended up on the streets because of domestic violence in the home, but where people had eyes on it, where the police had seen it. Again, I'm not going to totally blame the police for this. It's really a lack of resources. Now, maybe Kate wants to talk about safe harbor a little, since that's an expertise of hers. But
Yeah, so that's what police are absolutely essential for this entire process, particularly, again, I can really only speak from the United States experience, but, coming in a country with mass incarceration, not a lot of money, for services. So what do we have? What existing structures do we have? And jails are what we have more than emergency shelters. So in terms of a police officer asking what can they do, I think for me, it's by all costs, please do not arrest the person, whether they are a child or an adult that you're seeing as a victim. That is re-traumatizing. In fact, my research, shows that in the United States, the vast majority of states retain the right, have recently passed legislation, retain the right to arrest and prosecute children for prostitution. And the calculus behind that is that they need to be able to leverage those threats of arrest and prosecution so that kids will get services. You need to be compliant. We need you to be compliant. And so I ask that you come from a place of compassion instead of compliance. And at the same time, I understand you police, you have a particular mission, but really coming from this place of what do you have? And if a jail is all you have, to collaborate and work with on a task force or within local organizations to get resources to have even an emergency shelter for a night, have a safe place for someone to go there where they can just rest, get off the streets for a little bit, or in terms of get away from a rapist, from a perpetrator, in a way that is non-punitive. Just having those non-punitive relationships. Again, my research shows that the more you have non-punitive relationships, the more someone can heal and navigate programs, and then systems level. That's the trick with trauma, is that what heals trauma is healing interpersonal relationships. And what's difficult about that is that most of the trauma that we experience is interpersonal violence. And so how do you heal that so someone can continue to work within these systems that could be terrifying from them. So just being that person within your mandate of being a police officer, but how do you do this in a trauma-informed way? And I'll just leave with the fact that in, from saying this, in the United States in 2019, there were 214 minors were arrested for prostitution. That might not sound like a lot. It really might not sound like a lot. But when you think about, even as Ambassador Marbury talked about, from a federal level, you can't do that. You can't arrest or prosecute a minor for prostitution, but at a state level, you can. So there's a lot of leeway, a lot of collaboration that you can do as a police officer. And as a police officer and as a prosecutor, you have the most power in this whole system. You really do. And again, I could wax poetic about that for hours as well, but that's where I end with that. Use your power to create a trauma-informed system of policing around trafficking.
Thank you, Kate, and thank you also, Linda. Those are some very powerful words to end this session on. And I know that in our longer term efforts to work collaboratively in Liberia to address trafficking, that working with the Liberia National Police will be just one of many ways that we will hope to do that as international partners. And I hope that both of you might be willing to be called upon for some future iterations of that work, because your voices are invaluable. So thank you so much. I'm now going to turn it over to my colleague Cynthia to bring us into our final session today.